Assalamualaikum warahmatullahi wabarakatuh. My name is Monica Aprila. So, in this video, I would like to present material about a related to psycholinguistic, and it's about language impairment in bilingual children. About psycholinguistic, according to Haley 25, Haley defines psycholinguistic or psychology of language as the study of interrelation between linguistic factors and psychological aspects. And the main subject of the research in psycholinguistics is the study of cognitive processes that underlie the comprehension and production of language and the way the cultural environment interact with psycholinguistics and psychology. Um, Psychology also can be called as the study of the mental processes and skills underlying the production and comprehension the language and of the acquisition of the some skills called production, comprehension, and acquisition. So, psycholinguistics consider the skill of human language user as a complex information processing, uh, as a complex information processing system, and the aim of production, comprehension, and acquisition is to account for the user acquisition, production, system, and comprehension of the language in term various components of the system and the interaction. And there are some main components in production language. The first is conceptualizing, the second is formulating, and the third is articulating. The first is conceptualizing. Conceptualizing is a conscious planning activity in which communicative intention guides the construction of one or more messages or conceptual structures can be formed into the target language. And the second is formulating. As you can see that generating a natural language representation for messages. This involves two processes. The first is grammatical encoding. The second is phonetical encoding. So the grammatical encoding maps the message onto grammatical forms, and this involves retrieving item from the mental lexicon, and arranging them into a synthetic frame, and then the phonological encoding transfer the previous syntactic structure into a phonetic or articulatory plan. And the last is articulating. This element is executing the articulatory plan as the sequence of the articulatory gestures. So, and the primary execution models in this articulating, it can be oral or spoken language, or it can be written. And next is the language impairment in bilingual children, the main point of this presentation. So, the Individual with Disabilities Education Act, or IDEA, officially defines speech and language impairment as a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affect a child educational performances. This indicates impairment in which a child experiences challenges in pronouncing specific word sound. And the third is language impairment. It can entail difficulty comprehending words properly and expressing oneself and listening to others. And the second is a voice impairment. It involves difficulty voicing words. For instance, maybe there are some throat issues may cause an abnormality of the soft voice. And yeah, therefore, for a point that have been uh, represented by the idea. And about speech and language disorder, uh, both of speech and language disorder were reversed to problems in communication and related area such as oral motor function or speech. And the delays in disorder range from simple sound substitution to the inability to understand or use the language or use the oral motor mechanism for functional speech and feeding. And it's some causes of speech and language disorder, including hearing loss and neurological disorder, brain injury, mental retardation, and or maybe it could be a drug abuse, physical impairment like a cleft lip or palate, and vocal abuse or misses. But some reasons are being unknown, so there are a lot of causes that happened to speech and language disorder syndrome. So um, there are uh, some problem happened or occurred in the bilingual children. So uh, I found one children in one Korean reality show that I've been watching uh, frequently. So his name are Gonu, and both of his parents are are coming from two different countries. Uh, Father side is Korean, and the mother side is Swiss. So 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 he's been taught more than two languages in the house. Like for his sister, she can speak more than three languages perfectly. But when it comes to this boy, he I found that he a bit confused with expressing the word and confused with about which language that he should use. And so when he tried to speak, he got a little bit confusing, and sometimes he used the English rather than uh, his own languages from both sides of the parents. And I found some problem in bilingualism in children. So the first is language switching or mixing language. So when a young child learns two or more languages simultaneously, they acquire them in same way a monolingual child acquires one language. This means they go through the same stages of language acquisition as a monolingual child. So they start by babbling, including and they begin to say some words, and we will notice a few differences when simultaneous bilingual child start to produce words. They may blend parts of words from each language together and make word bands. And then between the ages of the 2 or 3 years, when they start to produce short phrases, we might notice them like they mixing the language together. Um, the second is uh, preference of one language over the others. So bilingual children sometimes you prefer to speak one language over the other language, and sometimes and this is normal. So usually it is the dominant language because they are exposed to it the most. Like Gonu language that he used the most is English rather than Korean and Germany. So having a preference for one language can often cause a strain of relation with the parents with the minority language. Yeah. So especially when it's in refuse to speak the language together. So they might be got a lot confused. And the last is being passive bilingual. So when a child or a person understands the second language completely but cannot speak it, they are referred to being a passive bilingual. So there can be a number of reasons for a child not speaking back in one language, including uh, the lack of vocabulary, not enough exposure to the language, and the main reason not being a need to speak the language. So this matter can be a common in family who uh, who have a second language, and it's not uh, it can be always consistent. It can be stressful, tiring, and difficult to keep the languages to be implemented all the time. Sometimes it's easier to let them respond with language that they want to use. So it will make them express themselves better, and sometimes we will. not going to notice it about it. So, how to resolve the problem? So the first is go to pediatrician and golf clinic. So take the child directly to the pediatrician or to a golf clinic. The child will be tested by the doctor whether or not there a disorder or delay in communication, and if there is, whether it's not only communication or maybe in other part of area disorder, it can be a cause true due to the use of language or other factors, and what challenge the most is the best for the children. And the second is increase the concentration of children. So becoming a bilingual person builds a brain power. So it's uh, for the children who understand two languages have better concentration and able to perform various tasks alternately. So the third is broaden children horizon. So apart for children who can speak two languages, they are able to learn books and literature from foreign languages. So the horizon will be broader than the monolingual student. So the last is make easier to traveling to other countries. So for children who bilingual understanding more than one language, so especially foreign languages, so they can make it easier for children when have to interact with people and from different countries, and it will help them traveling abroad, especially English language. So that's a little more presentation about bilingual children, language disorder, and bilingual children. So I hope I can deliver it successfully. And thanks for the attention. Assalamualaikum warahmatullahi